we're going to start with one of the first things you see down there in the ingredient list. Blood thinning. Nobody had checked the vape charge. Yeah, I got busy. I forgot it was in my bag. Last but not least. So before I forget, I want to give a big shout out to this person right here. We're going to be doing subscriber shout outs. I do notice y'all's comments. I usually try to comment or like y'all's comments or simply respond in the video. So yeah, shout out to this person right here. Thank you so much for being a part of the fam. And thank you so much for supporting me during my time here and when I'm off doing other things. And yeah, thanks for being here for my journey. If you haven't been here for the entire journey, please refer back to my YouTube channel and see that I've tracked my entire nursing journey online. And it's here for your disposal so you can learn what I did and what you don't need to do, because I failed a couple of times. Let's get into the video. Good morning, good morning, good evening, good evening, good afternoon, good afternoon. Good morning, good evening, and or good afternoon. It's your girl Kesi, and welcome back to my channel. Welcome back. Welcome back. I have taken a month off because I just can, and you know me. If you've been here long enough, you know me. I be taking breaks because your girl be needing mental breaks. She be needing to reset. She be needing to rejuvenate her ideas and whatnot. And here we are. We are here for the long-awaited Medication Mondays. So, y'all, this eyelash tickling my eye. I'm trying to make sure it ain't hanging off and I'm not embarrassing myself. This is the second time I've worn lashes in my life and I really like them. Self-applied. You know, these are the Glamnetic lashes. Not sponsored. If they want to sponsor me, guess what? Come through. But Glamnetic lashes is what I'm wearing today. And then OOTD is from, I think these pants are from Shein actually. And then this shirt is from Zara. It's a bodysuit. If you see deodorant stains, ignore it. It's none of your business. Today we are going to be touching on some medications that I've given in the past. So without further ado, let's get into the video. So all the information I'm giving y'all today is coming from a Davis drug book, as well as my pharmacology book from nursing school. It's the Pharmacology and Nursing Process by Lily Rainforth Collins and Cinder, or what did I say? Cinder. Yeah, Cinder. I don't know why that was so hard to read. So these are my resources. Don't be like me. So I have my notes over here. I don't know all these things by heart. I will be reading a little bit, but for the most part, I know what I'm giving to this patient. We're gonna do like a little case study, okay? So first things first, I'm gonna give you a little background of this patient. So this patient came in with a amputation of a limb and they had to have surgery to reconstruct. So surgery was on board, ortho was on board, and plastics was on board to reconstruct the limb and all that. It was a fairly young patient, so they really didn't have that much of a history. So anxiety, depression are the two main ones. So as far as the medications, we're going to start with bacitracin. Bacitracin is a class polypeptide antibiotic, which is used topically. The therapeutic action for this topical medication is to treat and prevent local skin infections caused by susceptible aerobic or anaerobic gram-positive organisms. So that could be like staph, it could be strep, cocci, or anaerobic cocci, corynebacteria, or clostridia. You don't need to know all that. Just know bacteria that infect the skin, okay, or the surface of the skin. So in this patient's case, because of the reason why they came in for the amputation, they suffer like a lot of scars and stuff around the wound. Not necessarily the wound itself, but around the wound there were like plenty of scars, and they had old incisions and stuff that they took staples out of. So they ordered this medication to put on top of the superficial scars, not the wound bed, because that would probably introduce a little bit more bacteria than we want. Opening the wound and then scrubbing around there with bacitracin. We don't want that. Nurses, quick reminder, any topical medication, bacitracin, in our case, you want to watch for itching, burning, inflammation, or any Any other signs of sensitivity to the medication, of course, you want to discontinue the medication, talk to the doctor and see if they have any alternatives, and also get the patient some Benadryl so they can work on that. Now, if you don't know what bacitracin is, you've never seen bacitracin before, you've never known what bacitracin is in, here's our friend. Look, bacitracin is one of the first things you see down there in the ingredient list. Bacitracin is basically Neosporin. Our next medication is Pregabalin or Lyrica. Lyrica is a class non-opioid analgesic / anticonvulsive. In our case, we're not using it as an anticonvulsive, mainly as an analgesic because probably, of course, in pain and also having phantom pain and nerve damage or whatever. So the therapeutic action for this medication would be to decrease neuropathic or post-herpetic pain, which is like post-herpes. Also, it's used to decrease the partial onset of seizures, which is not in our case. So the indication for our medication is neuropathic pain associated with peripheral neuropathy from diabetes, spinal cord injuries, fibromyalgia. I really just said fibromyalgia. Fibromyalgia, people. Fibro. In our case, amputation. So a nursing reminder for this specific medication is to remember with any controlled substance, you want to always assess for CNS changes because this is a controlled substance. It works in the central nervous system, and you want to make sure that your patient's like cognition isn't changing, their behavior, they're not having suicidal thoughts, they're not even more, you know, anxious or even more depressed. Like, you have to watch that, of course, with their vital signs and respiratory rate. Anything with the central nervous system, you got to keep watch. And then also, a lot of people forget that Lyrica is a controlled substance. So nurses, this is just a little side note for nurses, don't get caught up like getting busy when you got a Lyrica in your pocket or losing a Lyrica, because it's a controlled substance and you will be on the med diversion list and you can lose your license. So let's not do that. I've experienced being not written up, but just like dinged at the end of the shift when the charge nurse running all the narcotic scans and like administrations or whatever. It was like, hey, you held this Lyrica for 2 hours. Like, yeah, I got busy. I forgot it was in my bag, in my pocket, you know? So don't get caught up with that. I was on the list for a little bit, but we good. We don't divert over here. And nurses out there, you need to get help. No judgment, but you need to get help. Okay? So our next med, methylcarbamol or Ribaxin. This is a class centrally acting, think about it, centrally acting muscle relaxant. Therapeutic action is to what? Muscle relax. It's a skeletal muscle relaxant which causes central nervous system depression. So the indication for this medication is to treat, of course, muscle spasms associated with acute painful musculoskeletal conditions. Now, if you think about it, this patient had a amputation, so the body is literally trying to interpret and comprehend that this limb is missing. So it's probably spasming, trying to pull these muscles and get back to normal, but you know. So you could imagine if you had an amputation, you would have muscle spasms. With any kind of muscle relaxant, you want to assess the patient for pain, their range of motion and stiffness. You want to check their cognition because remember, it affects the central nervous system. You want to check for drowsiness. You want to check for dizziness and lightheadedness before therapy, because too much of this stuff can cause bad things. So you want to stay on top of it, sis. Stay on top of this. So our next medication is Enoxaparin or Lovenox. If you look at the end of this medication, what does it look like? It looks like heparin. Anybody out there in the crowd know what heparin is for? Blood thinning. So what is Enoxaparin for? Blood thinning. So Enoxaparin / Lovenox is for class anticoagulation and antithrombotic, so anti-blood clot basically. Therapeutic action is prevent thrombus / blood clot formation. So we use this to prevent VTE, DVTs, and PEs in surgical and medical patients. And if you don't know what those abbreviations are, here they are. Learn them get that in your brain. So a nursing reminder for patients on Lovenox, on blood thinners, on anticoagulants, your patients are now at a higher risk for bleeding. So your patients should be placed on fall precautions, because it would be very dangerous for your 90-year-old patient to be on Lovenox and they fall and hit their head and now they have an internal brain bleed. You need to make sure that patient knows, press this light, don't get up until somebody's in the room. This person is now one-to-one assist. Unless they're like 27 and totally, you know, ambulatory and with it, you want to, of course, still make sure they're being taken care of as well, and make sure they are taking the right precautions as well. Also, you want to check for signs and symptoms for bleeding in these patients. So excessive gum and nose bleeding, unusual bruising all over their bodies, hematuria, blood and stool. Also, like around the surgical incision, if there's excess blood seeping around that, just make sure the doctor's aware, make your notes, and just continue to take care of your patients while taking precautions. Make sure they don't bleed out. So our next medication, Deloxatine or Cymbalta. If you've never heard of this, this is a class antidepressant / SNRI. I know there's SSRIs, but this one is a SNRI, which is a selective serotonin norepinephrine reuptake inhibitor. And we'll have another video about the difference between SSRIs and SNRIs, but right now we're just going to talk about Cymbalta. So Cymbalta, the therapeutic action is to decrease depressive symptoms alongside with anxiety. So it can also be used for neuropathic pain, which is new for me. I didn't know that. So the indication for our patient is for the major depressive and anxiety disorders. So a nursing reminder, like all the other meds that our patient is taking, they're all usually affecting the central nervous system. So you want to, of course, assess the patient's mental status, their changes or worsening in depression, anxiety, and all that good stuff. So just keep watch. Keep watch. Our last medication, last but not least, this is a good one. A easy but a goodie. Oldie but a goodie. I don't know what I'm talking about, but our last medication is Vancomycin or Evankelsen. Vancomycin. It's a class anti-infective. Therapeutic action is to prevent the growth of bacteria. So there's bacteria. It's in your blood. It's there. We know what it is. Vancomycin. It kills it. It's a very mean drug. But the indication for this medication is used as a broad spectrum antibiotic used to treat life-threatening infections such as staph infections, even like soft tissue infections in patients that are allergic to penicillins. And for our last nursing reminder, you want to always, always, always think ototoxicity and kidney damage with vancomycin. You want to always check their kidney function and make sure it's okay, and then also check their toxicities. Make sure they're not getting too much vancomycin. I can't express to you the time that I came to work after my 4 days off. I had nothing to do with this, and I did the trough because I realized this patient had gotten their 4th, 5th, and 6th dose of vancomycin. And nobody had checked the Vanc trough. And I'm like, oh God, let me just go ahead and order one real quick and draw it and send it. This trough was in the 60s, y'all. 60s. Who is you? So glad to see you made it this far. To confuse everybody in the comments, because you loyal, you stayed. Comment your best friend's name. Let's confuse everybody. Of course, this made this patient sicker, and of course, this patient had to stay in the hospital longer so we can get this trough down. So be mindful. Even when you don't have a doctor's order every single time saying what and when you need to do something, be mindful what drugs you're given. Be mindful that, oh, this is the type of drug I need to do a trough for and a peak for, and maybe even a random for, just to make sure, you know. So just keep watch. Usually it's before the 4th dose. You want to do a 30-minute before trough to see what the levels are before you actually give the next dose. So y'all be mindful and don't forget your Vanc troughs, okay? So those are all the medications for our amputee patient today. This patient also had 3 more meds that I covered in my last video, which were Colace, Miralax, and Senokot. I had the patient on a bowel program because the patient is getting so many controlled substances. They didn't want to stop the bowel function and make another problem. So if you want a little bit more information about those 3 meds, you can go to my last Medication Monday that I uploaded last year. But yeah, that's it for today. I hope you guys enjoyed this video. Please let me know what type of schedule you think I should go on as far as the Medication Monday. I know for sure every Monday is not reasonable for me. So would you like a once a month type thing? Would you like a every 2 weeks? I can do it every 2 weeks. Let me know. Let me know if you like this style where I just pop the medication up. Let me know if you like the last style when you actually saw me have the medication in my hand and took a picture of it and you can see the thing. Let me know. Just let me know what you like. I'm trying it out. It's just like a trial and error type thing, but I just really hope you guys learned something today, and I really hope that you enjoyed this video. So be sure to talk to me in the comments and follow all my social media below, and I will see you on my next video.